lesson. Sometimes we always kind of think that the best option is to try to solve someone's problem.
No.
And I've learned early on in my career that that doesn't work. No. And so we don't want to solve people's problems. We want to help them solve their own problems and find good solutions, healthy solutions, things that are going to work for them.
Which I think is super frustrating for clients when they're like, no, you're supposed to tell me what to do. And it's like, no, I'm not. Because if I tell you what to do and you do it and it works, now I'm the only person that can solve your problem.
Right.
But on the other hand, if I tell you what to do and then and it doesn't work, like now what happens to our relationship? Is my opinion valid anymore? Do you continue to come see me, or do you abandon ship like you were talking about before and like, oh, that didn't work for me? It's not my job. It's not my life. It's not my consequences. I'm supposed to get you to think about things maybe in a different way than you've been thinking about them, so that you can start connecting your own dots, so that you can create your own map to where you want to be.
I think another reason for the siloedness of the health field, where it's like, okay, you go to the doctor prescribes you a medicine, so you go to a doctor, and that's maybe where you first kind of express to somebody that you're struggling with depression or anxiety and stuff, and you know, our hope certainly is that doctor says, okay, the first thing I'm going to prescribe you is to go to Life and Purpose Behavioral Health and go talk to somebody, because you know, ultimately, well, and this is my personal, everybody has different views kind of it, but like I kind of see medication like, you don't take ibuprofen every day, you know, to prevent headaches. You deal, you know, you maybe use it as kind of an assistant in the but it should be short term. Like you shouldn't be on psychotropic medication your whole life, because there's a lot of things you can do in your life to kind of manage those symptoms, to help you feel better, to change kind of the trajectory of your life and things like that. Now, so we don't, I always kind of say, it's like, if you have a medication, that's fine and use it, but we don't certainly want that to be the only thing you do for your health.
No.
Because typically, there are things going on in your life that we haven't really figured out. There's a lot of things that don't require side effects of medication or medications in general, that you can change your brain for the better and do those things. So we're certainly an agency that we have psychiatric services, and we support them in what they do, and we appreciate all that they do, but we don't see them as our first stop. They are ones that when we are working on things and someone needs a little bit of support in that area, then, you know, we send them there to kind of get that support. But our goal is always, hey, you know, we want you to be able to kind of make those changes.
Yeah, and I think similarly, I don't want people to have to be on medication their whole life, but at the end of the day, if you do need to be on a medication every day for the rest of your life, that's great. Let's figure out the lowest dose that we can have it be. You know, medications that I take on a daily basis that it's not like you take the medication and then like everything's done. You still have to take care of yourself. You still have to practice skills. And the thing about medication doesn't fix anything. It doesn't fix anything. It just takes away something. It's like a Band-Aid. So if you're riding a bike, and I was at Washington School Playground when I was like 6, and there used to be like the exit ramp out of Washington School Playground, and there was gravel on each side. I was riding my bike and I turned too fast, slid out, huge gash in my knee. Well, in order to figure out, does my mom just get out the Neosporin or do we go to the hospital for stitches, we had to stop the bleeding first. So you get a Band-Aid, you get some type of compression, so you stop the bleeding so that you can assess the injury. That's how I think of medication a lot of times. It can sometimes slow down the things that the neurotransmitters in your brain won't allow you to have control over, so that you can figure out exactly what it is that you need to do to help repair whatever is going on in your life. So an antidepressant or a mood stabilizer, it can maybe slow down your racing thoughts so that you can make sense of them, so that you can apply some of the cognitive behavioral methods that we have. But at the end of the day, taking the medication doesn't, and I always tell people, I have attention issues, and so I need to take medication for that. Figured that out in college. And I always tell people, like, listen, this medication makes me able to study and understand science. It doesn't make me care about science. I still don't care about science. I still show me the research, give me the headline of the article. That's what I care about. But now I have the capacity to apply myself in a meaningful way. You still have to do the work to get the outcome that you want. And I think sometimes that's misunderstood about medication and the point that it plays in mental health and even maybe sometimes physical health. Diabetes, for example. We have insulin available for people with uncontrolled diabetes. And there's, I think, this conversation sometimes about, well, they can still live these irresponsible lifestyles. They just use insulin after the fact. Well, that may be true, but isn't it wonderful that science like that exists so that people can live how they want to live? Mental health, like we don't have an insulin of mental health.
But it helps them in terms of we're going to use this until you're able to kind of change your diet and exercise and get in, you know, and I've known people and seen people kind of no longer be diabetic because of the way they've changed. Lifestyle changes and no longer need that medication, but in order to make sure that they're healthy enough to change their lifestyle, they need that kind of medication. One of the things that I kind of noticed when so I worked with kids for 20 some years. It was, I mean, kids and families, but my primary therapy was with kids. And I came over here and started working with adults, and there was a lot of adults in pain, like physical pain. Like a majority of the adults I saw had physical, whether it's back,
which is also knees. Something that is like very characteristic of our area. We are blue collar, hard work, labor-intensive jobs. Those are the types of jobs that most people in this area work. So most people at a very young age start to have their bodies start failing. Their bodies start creating pain. But you can't stop working.
Well, one of the things I noticed though is the anxiety and stress that they had, especially about their pain, but just in about of maybe what it wouldn't allow them to do. Intensified their pain. Like I kind of equate it like I coach my daughters in soccer, and when they're young, a lot of times the ball gets, you know, kicked and hits them in the face, and they get knocked down or they fall, and they're crying and everything like that. And my job is I go out on that field and I'm regulate them, I'm teaching them to breathe, and I'm getting them calmed down. It's the same pain, but man, when they calm themselves down, because, you know, I get out there and they're crying and breathing heavy and stuff like that. But sure enough, unless there's a broken bone or whatever, if you help them regulate themselves, they don't have that pain anymore and they're back on the field. I know that's not the answer for everybody's pain, but oftentimes we have to take care of our body, our breathing, the way we care for ourselves. That's going to reduce the intensity of the pain. It's going to reduce, you know, so that was what I was noticing. It was like anxieties over traumas. I mean, like the really difficult events in their lives were making everything that they experience so intense and so difficult. And until we help them kind of learn to kind of lower that intensity, you know, whether it's, you know, through the different interventions we talk about, or just even talking about it, or whatever, that pain stays pretty high. But it can be done. You can bring it down. And that's why I think sometimes, you know, people get injured, it's going to have a psychological effect on us. It doesn't mean there's something wrong with you. It just means that, okay, something happened in my life causing an impact in an area that I need to address.
An event happened. It caused me a consequence. I now have thoughts about the event because of the consequence. And if the consequence is big enough, we take those thoughts with us and apply them to every event that looks like the event that caused my consequence. So anybody that graduated from Marietta High School, typically every year we have an alumni basketball tournament. About 4-ish years ago, in a game, a girl slid into my knee.
Ouch.
They told me at the time that I had ruptured my ACL, so I had like the immobilizing brace, and I was on crutches. That I wasn't the best at using the crutches, but
I know the feeling.
And so now when I think about the alumni tournament, my first thought is not, it's going to be great to get back together with my friends and play basketball the way that we used to when we were in school. My first thought is, I have to be really careful, because that was a real inconvenience to me when Monday came and I was in an immobilizing brace with crutches. But that doesn't mean that I don't play. Because you have to be realistic about your thoughts. It wasn't that I tore my ACL. It was a lower impact injury than that didn't require surgery. But I could avoid basketball forever if I don't monitor the way that I think about the event, which I think is what happens with people who are in pain. We don't want to be in pain, but pain will happen.
Yeah.
That is a consequence of being alive and being a human. Pain will happen, whether it's physical or emotional. The way that we talk to ourselves about our experience of that pain is, in like what you're saying, to a great degree, the determining factor of how severe does it get. Because I have seen some very calm people with very broken bones laying on a basketball court calm, because they're talking to themselves in a way that allows them to be calm.
It's going to be okay.
Not, oh my
right,
gosh,
yeah.
look at my arm, my bone is popping out of my skin. But instead it's like, I'm going to be okay. I'm not going to die. The ambulance is on the way. Like, you can regulate even in extreme pain. The bone is still broken. Whatever has happened has happened.
Right.
But our experience of it doesn't have to be catastrophic just because it appears catastrophic from the outside.
And I think it's important, and I went through a training recently and they talked about this, that the body is designed to heal. Like we're designed to heal. And I think that's not just in a physical sense, that's also in a mental or emotional or psychological sense, that we're able to heal ourselves. We have, I think Bruce Lee said, the solutions within us, like we're able to find what we need.
Yeah.
We might need some direction and support, but it's there.
Right.
Like, we don't have to, we can get through things. And we are, our brain's a pretty amazing thing. It can do a lot of great things. We just have to kind of tap into that.
Right.
But I think I used to go back to, injury, like kids kind of get injured and then they're tentative out on the field and stuff. And I think that makes you even more vulnerable to get hurt again.
Yeah.
Like, it's kind of that, so there's
like
there's a connection.
You're the most likely to have an injury in a car accident if you tense up instead
right.
of just let your body become a noodle.
Right.
Because then it adapts to whatever it's crashing into at the time.
But if you're going slower because you got in a wreck and
Yeah.
you're kind of really tense and you don't know, then you're so focused on something instead of paying attention to what you need to in the traffic
Right.
and stuff like that. So there's nothing is ever in isolation. You don't have a physical injury without a emotional attachment to it. Like there's something that happens. It affects the way we operate, the way we function. Let me ask you this. What would you want people to know about kind of who we are and what our goals are, or what we're there for in order to help them?
I would like to say that I want people's experience to be warm and fuzzy and comfortable, but warm, fuzzy, comfortable isn't where change happens. So initially, I want you to feel comfortable. The therapist that you're going to be, we're all people.
Right.
You don't become somebody who spends 40 hours a week talking to people because you don't like people.
That would be
so we are
interesting.
people. We are interested in you. We care about you. And the care about you is, I care about you as a fellow human being on this planet.
Yeah.
And I want to help you do whatever it is you want to do. Eventually that relationship shifts from let's get to know each other, let's get comfortable with each other, to, as a therapist, I start pushing you. Therapy is not meant to be I don't think, a super comfortable, happy place.
Right. So you want to stretch them a little bit, but
Yeah.
not overwhelm them, not
Yes.
put them in some position of defeat, but we're going to stretch them a bit.
And so to some degree, the client gets to choose how much they're going to be stretched. If you're like, nope, that's too much for me today, okay, but that doesn't mean that we just kick back and talk about the basketball game last night.
Right.
Or how irritated you got with your kid last night. Like, we still need to be working on things. My job, my purpose of knowing you is to help you reach your goals. So I need to stay focused on what can I do to help you reach your goals. If you're not willing to stretch to a degree that maybe I think you're psychologically ready for, totally fine. You get to protect yourself from injury. But there should be a compromise somewhere where you leave feeling almost, I actually had a client say to me recently, they were like, something you just said connected. She said, what were you saying before? I said, it doesn't matter, because whatever I was saying before has you connecting dots. So what I was saying before doesn't matter. I said something, it stretched you. And now you're able to connect dots. It doesn't matter if those dots connect to what I actually said. That's sometimes not how the brain works.
Yeah. I know for me, I think I always say you get out what you put in.
Yeah.
So if you come to us and you put in very little, you're gonna get very little. If you put in a lot, you're gonna get a lot. And by no means does that mean that you have to overextend yourself or put yourself in a situation that is too much for you.
Right.
But movement doesn't happen unless you kind of engage in that movement, and you have to kind of make that effort and make that and we're asking people to take a risk. We're asking people to be vulnerable with us, but we think that it's going to be okay to be vulnerable because we're creating a safe environment for you. But that vulnerability allows us to get to those maybe self-defeating patterns or things that are kind of getting in the way, and we can help kind of build whatever kind of capacity we need to build for you to be able to be successful and to kind of make those changes. And ultimately, I think relationship is paramount, and so we are going to focus on connection and making, and that's where safety comes in. If you feel relationally connected to us, then you're going to feel safe, and we're going to be able to work through that. But it is hard to make progress if we don't stretch and stress.
So Kristen Bell gave this interview years ago about her therapist and her experience with her therapist and how it helped her, and it helped me be more realistic about my role as a therapist. And what she said was, when she first met her therapist, she came in and she was talking about all of her problems. He asked the floodgate opening question of what's going on. And she just starts like laying it all out, and he like halfway through stopped her and was like, that's all really fascinating. I'm gonna listen. You tell me when you want to do something about those things. And she was like, I get to decide what I'm going to do? Yeah, it's your life. You have to decide that you want to change it. If you want to come in here, and my job in your life is to be like the output vent where you let the things out and then I take them and I dispose of them as a professional, I can be that for you. If you want to come in here and you get sick and tired of something and you want to learn how to be better, I'm here for that. Tell me what you need from me. Tell me what my function in your life is, because as therapists, it's our job to adapt to whatever that particular client needs. So if you need to come in and tell me about all the horrible things in your life and you're like, oh, I feel so much better. I'm good now. Great. I'm super happy that I was able to help you today.
Right. And sometimes that's all maybe someone needs is just a venting, but then you shouldn't be in therapy for that long over that, because we need to find you a natural support that you can vent to, because that should be something that is available to all of us. A friend, somebody that we can unload and don't require any solutions or change in that respect. But so. And
in my experience, the stretching is asking, like, do you want to do anything about that today? Would you like to change that in any way? And eventually people get tired of saying no. They're like, no, I don't want to do that. No, I'm not ready for that. Eventually people get real tired of that. When you ask it a certain amount of times, that's the stretch that happens.
Sometimes the mirror comes up.
Yeah.
And you have to look at yourself and kind of say, oh, I see what I might have done, or how I might have kind of gone down this road that I shouldn't have, or I know, or I can see how I can get myself to a better place.
Yeah, I see the role that I played in a particular situation.
Yeah.
Maybe before it was somebody else's fault, but being able to look in the mirror and honestly take accountability for your side of the street. Because I would say a lot of people come to us about issues with other people. They have issues with other people, and that's creating them some type of pain or suffering. We can't change that other person. All you can do is change yourself. So if you come to me expecting me to be able to say something to you that you can say to your loved one that's not how this works.
Right.
All you can do is take accountability for what you can control.
The work doesn't just happen in that 1 hour per week.
No.
There's 23 other hours in a day. There's 6 more days of that. So there has to be, work that is done in between sessions. That's going to really, if you want to make change in a pretty reasonable amount of time, especially as adults, because it takes our brain a little longer to change. But if we want to kind of really make impact, it's doing things in between as well. That's where the real work happens.
Yeah.
So, and I think I'm hoping people walk away kind of with a idea of what to do in between sessions, that they're, because that's going to be huge. And that's more important, I think, in our non-intensive services where they're only seeing somebody once a week or even, less than that. But our intensive services still requires that, but at least they, get a lot of frequency of intervention. But yeah, so. Well, this was fun. I enjoyed this. I could talk about this all day, but I don't think anybody wants to necessarily listen to us all day. But so I wanted to thank you and everybody who is listening and watching. Thank you for spending the time with us. And I'm hoping that you guys have any questions or thoughts or comments in terms of mental health or in terms of kind of mental health in the Mid-Ohio Valley or anything like that. And if you have any questions for kind of future episodes or segments, please send them our way. Thank you.